I've been looking at some footage out of Australia this morning, and it looks like there are less people out in the streets. What are some of the precautions your country is taking at this time?
The state governments and the federal governments have coordinated together with a consistent set of policies, shut down various industries where there was a lot of human-to-human contact, and moved people, where possible, out of schools, but keeping schools open so that essential workers' children can still be educated while the people on the front line are out there doing their jobs.
It's very hard, I guess, to predict how things will become, back to business throughout the globe in a normal sense. Some predict 10 years, some 20 years.
The first thing I would say is we will not go back to where we were. I think anyone who thinks this will be just like a standard recession where the economy slows and then the economy takes off again and we go back to some growth path we're on, that's not my view of what will happen. I don't think it will end. I think different countries will adapt in different ways. This is something that's going to have to be managed over many, many years. If the previous SARS, coronavirus outcome, and even AIDS, there was never a vaccine. And so what happened was countries were able to create ways of managing the illness, ways of managing the spread of the illness, and ways of helping the people who are affected, either economically or socially or physically, from the disease outbreaks, as well as better understanding of the disease, because we still don't know everything we need to know about COVID-19, and that's critical that the research is undertaken very quickly.
McKibbon is a professor of public policy at the Australian National University. He has been studying the relationship between global and regional economies. However, in 2020, he quickly changed his focus and started analyzing the impact of the coronavirus on the global economy. That's because he predicted the pandemic raging last December in Wuhan, China, will have a devastating impact on the world's second largest economy. McKibbon looked at data on outbreaks of past infections and estimated the human and financial losses if COVID-19 spreads. He came up with 7 scenarios, depending on the severity. Scenarios 1 through 3 assume the epidemiological events are isolated to China. The higher the number, the more severe. Scenarios 4 through 6 are the pandemic scenarios where the epidemiological shocks occur in all countries to differing degrees. Scenario 7 is a case where a mild pandemic is expected to be recurring each year for the indefinite future. Tell us about the start of your studies.
At that point, we didn't know it would be a pandemic. We knew that there was a serious problem in China, and so we came up with what we thought covered the range of scenarios. Well, what we looked at was history first. We looked to see what other pandemics had broken out, and the obvious ones were the Spanish flu, the Asian flu, and the Hong Kong flu. And each of those scenarios had a different epidemiological outcome. That is, the number of people infected was different. The death rate across the infected populations was very different. So we took those 3 different combinations and mapped them onto, firstly, China. Suppose we had those 3 different outbreaks in China and it didn't spill over to the rest of the world. So we just wanted to pick up the economic consequences of a very big slowdown in China. And then the next 3 scenarios were assuming the same mortality and infection rates, but adjusting it across countries based on a whole range of indicators like quality of public health systems, availability of antiviral and retrovirals, a whole range of ways of scaling up or scaling down the economic shocks. And we looked at that across the world, across all countries.
McKibbon's scenarios were first considered unrealistic when it was published at the end of February. That attitude changed in the middle of March. Infection of the new coronavirus quickly spread to Europe, the United States, and to other countries, leading to a jump in fatalities. The impact on economies also rose. McKibbon assumes that if infections lead to scenario 6 on his scale, the U.S. will lose 8.4% of its gross domestic product. Japan will lose 9.9% of its GDP. Those numbers are getting close to the actual figures.